Hey guys, this is Dr. Hub. Today we are looking at the primary invasive carcinoma of the cervix and its treatment. So in terms of the stages 1A1. So in stage 1A1, the fertility is preserved. So it is a cervical conization. So in terms of fertility is not preserved, then it is simple hysterectomy. Next we move on to the 1A1. This will be the LVSI. So under this, the fertility is preserved. There is radical trachealectomy as well as the pelvic lymphadenectomy. There is radical trachealectomy and the pelvic lymphadenectomy. Next is the question arises when the fertility is not preserved. So when it is not preserved, there is the modified radical hysterectomy, the MRH, modified radical hysterectomy, as well as the PL, that is the pelvic lymphadenectomy. Then we move on to the IA2. IA2, where the fertility is preserved, there is the cervical conization. So the cervical conization is with the extraperitoneal pelvic lymphadenopathy. So this is with the extraperitoneal. So extraperitoneal pelvic lymphadenectomy. Next is the fertility is preserved in terms of IA2, that is in case of the radical. So in terms of the radical trachealectomy. So radical trachealectomy as well as the pelvic lymphadenectomy. Now, what if the fertility is not preserved? So in 1A2, if the fertility is not preserved, we again go for the modified radical hysterectomy and the pelvic lymphadenectomy. Then we move on to the IB1. So in terms of IB1 and in terms of some IB2 and A1, so in terms the fertility is preserved. So in terms of fertility is preserved, what is it? There is radial trachealectomy. There is RT, that is radial trachealectomy, as well as the pelvic lymphadenectomy. So radial tracheectomy and the pelvic lymphadenectomy or the chemoradiation. Now in terms of the fertility is not preserved. So in terms of fertility is not preserved, we go for the radical hysterectomy as well as the pelvic lymphadenectomy or the chemoradiation. Next, what we do is we move on to the bulky IB3. There is the bulky IB3. So under the bulky IB3 or the 2A or the 2A2, so what we do is we do the CR, that is the chemoradiation. Next, moving on to the 2B or 2-4A. So in terms of 2B to 4A, what is done? So 2B to 4A, it is nothing but the chemoradiation as well as the pelvic examination. Then we move on to the 4B. 4B, it stands for the palliative chemotherapy. So you do a palliative chemotherapy as well as the palliative radiotherapy, or we move on to the supportive care.